Good afternoon, everyone. The case conference today is of a 31-year-old Hindu male who has studied till class 9, failed in class 10, working as a steno in Haridwar, living in a joint family belonging to middle-class socio-economic status according to Kuppuswamy, a modified Kuppuswamy classification, a resident of Haridwar, with informants, his wife, a 30-year-old graduate who is a housewife, his mother, a 54-year-old female who has studied till class 6 and is also a housewife, and his sister, who is a 34-year-old female, a law graduate, who is currently working in a law firm, and the patient himself. The history given is clear, coherent, consistent, and given in a chronological manner, with the complaints of alcohol intake for the past 12 years, suspiciousness for 2 months, seeing things not seen by others for 1 month, hearing voices not heard by others for again 1 month, restlessness and decreased need for sleep for the past 5 days. The complaints are insidious in onset, continuous in nature, and have a progressively deteriorating course. The patient was apparently well 12 years back when he first started consuming alcohol, which would constitute of Indian-made foreign liquor only. Initially started with friends, quantity of around 90 to 120 ml, mostly in the evening outside of his house, after which he would come back home, sleep soundly and not report of any headache, nausea, dizziness the following morning. According to the patient, it was only after his sister's wedding about 8 years back wherein his consumption now increased to up to 250 ml of whiskey. This increase he attributed to his sister's marriage, who the patient was very close to. With now the frequency of drinking becoming more frequent, his family members urged him to get rid of this habit, and if not, then at least do it at home. And since then, the patient now, along with 1 or 2 of his friends, started staying home in the evenings and drinking alcohol. The frequency again progressively increased to now daily consumption, and the amount also steadily rose to now the patient consuming about 500 ml of Indian-made foreign liquor. On not receiving the alcohol, the patient reported of decreased sleep, ghabrahat, restlessness, and he reported that it was only to curb these effects, his frequency of alcohol consumption became a daily occurrence. In the meanwhile, the patient's marriage was fixed. This occurred 7 years back, and during this time, his now wife reported of a decrease in his consumption of alcohol, occurring about 4 to 5 times a week, and an average quantity of not more than 500 ml of Indian-made foreign liquor. This again continued for this next 6 years. But since the patient works at Ayurvedic Vishwa Vidyalaya in Haridwar, during the times of COVID vaccination in 2021, his workplace became a vaccination site. Subsequently, the patient had to work sometimes even till 2 in the night for recording and managing the vaccine vials that were being sent to their center. Subsequently, the patient reported that he asked his seniors about the viability of these vaccines, to which they replied that the vaccine isn't as viable as they are marketed, and these vaccines may also cause a decrease in one's libido, and a short way to boost immunity is alcohol. The patient now reports that since then he would drink about 90 to 120 ml of alcohol before coming to work, and then returning home, he would now drink even in his room by himself. It was also during this time the family members reported that the patient started spending almost his entire monthly earning on alcohol, which would be about 15 to 20,000, along with the money he would borrow from his father for the same reason. It was now around this time the patient would also loan increased amounts of sums of money to his friends to buy alcohol for themselves. The patient was then subsequently admitted for complaints suggestive of jaundice in a local hospital. After his discharge, there was a brief period of abstinence for about 2 to 3 weeks, but the patient subsequently, after one outing with his aforementioned friends, resumed his alcohol intake, and this time with an even more amount. This quantity now rose to about 1500 ml of the Indian-made foreign liquor, an average daily intake. But subsequently in 2022, in the months of January, February, the patient was again admitted with similar complaints suggestive of jaundice to a local hospital. Thereafter, again on being discharged, he was abstinent for about a month. This time, but on Holi, in the month of March 2022, he again resumed with his intake. Since the months of March and April, there was no period of abstinence, and the patient now would mostly sit by himself in a room and consume the same amounts of 1500 ml of the liquor. The patient further reported now of complaints of suspiciousness for the past 2 months, wherein he reported his aforementioned friends were calling him repeatedly asking for a favor, mostly a monetary favor. But since the patient had cut ties with them, he refused to answer his phone. He would go on to tell his wife that his friends, which included a neighbor who was older than him and a cousin brother of his, would now devise a plan against him to get revenge from him. He further reported that wherever he goes, he's preoccupied with how everyone around him knows that he betrayed his friends, and they are pointing towards him and laughing. He then reported that his cousin brother is also trying to establish a temple of a deity in whom he doesn't believe forcefully on his property. He then goes on to report that on one occasion when he was sitting at a barber's shop, his friends again started repeatedly calling him, but this time also he did not answer their calls. He then reported that he suddenly felt a searing pain in his abdomen and felt as if an insect was crawling inside of him, drinking his blood and gnawing at his organs. He then reported that he felt very weak at that moment and had to ultimately answer his phone in order to seek help, and he did not grant his friends that favor. After doing so, he did not thereafter feel anything when he granted them the favor. He did not feel any crawling or moving inside of him. He now further divulges that he has on occasion seen this bug crawl inside of him whenever he doesn't comply to his friends. It is a gray colored insect with 2 eyes, 6 legs, looking like a cockroach, and it is unable to fly and can only crawl. He further reports that this insect is being controlled by his friends and is eating him from the inside, all the while not reporting of any abstinence from alcohol. The patient now goes on to say that his friends also communicate with him through this insect. He does not have to use a phone to communicate with them, and he can hear their voices through this insect. He only needs to place one hand on his abdomen and the other to his ear, which helps him to directly connect with these people. The patient was then admitted for complaints suggestive of jaundice again to a local hospital on the 16th of May. The patient on the day of admission asked his wife to go back home and said that he can stay there alone. But the staff reported to his wife the next morning that the patient laid awake the entire night and was restless the whole night. The following day, his wife further reported of irrelevant talks and restlessness when she stayed with him, wherein he would go on to say things like, "मैं नीचे सो जाऊंगा, तुम चली जाओ." When the wife would ask what he meant by that, the patient reported that he is in his house presently and niche is his parents' house, room. That night, again, the patient was restless and kept muttering to himself all the while pacing in the ward. He would ask his wife, तुमको सुनाई नहीं दे रहा है कि कितना शोर हो रहा है आसपास? सब आपस में लड़ क्यों रहे हैं? Despite that not being the case in the ward. The following night, patient was extremely agitated and was continuously asking for his discharge, all the while muttering to himself. So the family members subsequently discharged him and brought him home. Now, the following day, patient again consumed about 750 ml of Indian-made foreign liquor during the course of the entire day. But the next day, his wife reported of the same complaints of restlessness and decreased sleep, wherein he was constantly running up and down the stairs of his house, shouting angrily at passers-by, suspecting that they would break into his house and harm his family. He was also constantly muttering to himself as if having a conversation with someone. And on being asked who he was talking to, he initially reported of a cacophony of voices, but then specifically named his cousin brother, who was trying to capture his property for his personal gain. He was then brought to the hospital subsequently the following day, citing these complaints, wherein the patient reported that he could still hear his friends talking to him through that insect crawling inside of him and calling him a coward for running away. There are no history of thoughts being introduced into mind by an external agency against the will. No history suggestive of any gustatory hallucinations. No history of any repetitive thoughts, compulsive acts. No history of any head injury, loss of consciousness, abnormal body movements associated with urinary incontinence, tongue bite, frothing from mouth, uprolling of eyeballs, blurring of vision. No history of vomiting and no history of any other substance in it.
These are what the Latin is called being a transducer.
According to the family, he first told them about this insect 5 days back, 5 days prior to his admission. And the history that he gave me, he told me about the existence of this bug since 20 days. Sorry, 1 month.
And okay, so there is
Yeah.
Then it was confirmed that he was doing this assessment before 5 years. So he was doing this in front of us.
Yeah.
He had
So because he has on occasion said that, like I mentioned, this man who was older than him and who was his neighbor, the family members were also aware about his ill intentions, that this man would constantly ask for money, to the extent that our proband has given about 5 lakhs to him. And they have on occasion asked him to not indulge him in anything. And he has on occasion even confided in his wife that if I don't, then they are going to harm me. And he did not tell in what way they are going to harm me, but he has on occasion said that they're going to harm me. And तुम्हें नहीं पता कि बहुत कुछ चल रहा है मेरे साथ, मैं बता भी नहीं सकता हूँ. That is something that the sister has said. Yes. No. No.
was there an explanation or an alternate explanation for the money?
Initially, it started off with all of these people used to drink together. So initially, it started off as a loan only, wherein they needed money for alcohol. But then this older person's wife once got admitted. This older man himself once got into an road traffic accident. He was subsequently admitted to USME, and a lot of his family crisis was being dealt by him, the patient. So that is why he had been loaning him quite a lot of money.
That can be a personal explanation that he was always with him.
But like the sister would say that his income is not so much. These people are mostly dependent on the property left by their grandfather, and he's not earning more than 20,000 in a month. So it's giving so much money to somebody else, so to the extent that he even has to take a loan just so he can give him the money. So that was a little.
That might be acting out because of his relations that he's having. That might be not acting out. That's the only acting out which is
Yes.
in the day previous to this guy. Suddenly he was everything in the night.
Diverse, sorry.
Suddenly he was every information that was in the secret in this guy. Very asking. Is that the mention in relation to the telling that he was always thinking that relation between this acting out or these things with the
Abstinence.
the acting out with the drinking individuals, with the drinking time. Was he doing this under the influence of the substance? Was he doing this out of the influence of the substance? That was his problem.
Yes.
We are telling that he was doing continuous.
Yes.
And this is the vibration he has stopped.
Yes.
Why?
So, but could be, so what he told me was he would drink in the morning. Matlab he said that he would not drink in the morning, go to his work because there were some important people coming for work. So he would not drink in the day. And it was only in the night. But his wife said that before going to work, he would drink. Whereas he said that, so I'm thinking that there was maybe an interval during the day when he would meet up with these people. And the wife has also said that he would stay with them for about 16 hours. वो बोलते थे घर पे that he is going for his work and all, but he would stay with these people only. So there are a few blurry details as to whether or not he used to drink with them or whether he used to go to work. So I'm a little insect. Yeah. Any behavior, sir? I've taken one thought sample in which just the pain abdomen that he would report of, just that. and decreased appetite, and that he would feel very weak from the inside. He would, I've mentioned that later on, he would feel very weak, decreased appetite, and pain at home. That's it. Hmm. Yes. Sir, I've mentioned it in the sample that I've taken. He said that on one occasion he has seen that insect crawling inside him in lines. And there was this one instance where these two people, they showed him that insect on their hand. It was a gray insect, and they said, "ये हम तेरे पीछे छोड़ देंगे if you don't abide to what we are saying or if you don't listen to us." And then later on, they told him that हमने वो तेरे अंदर डाल दिया. This is the patient's account. And he said that I have seen that I've seen that bug in crawling inside me. It forms lines on my abdomen, and when it eats, it gnaws on my organs or it sucks my blood, I can hear it. Lines. He's seeing the lines. He has seen. No, not inside. That crawling, sir, that line.
But is it that the line
The lines.
not that
The insect, the family members have not seen those two people. I did not corroborate about it. No, he hasn't. No.
So the he seemed but not well are lines, right? Line only the
Lines.
okay.
So all of these things he mentioned to ma'am, but not to me, sir. He has mentioned about this other fantastical being as well, which looks like a thing between a dog and a wolf, and it apparently comes to the roof of people's houses and eats females. He has mentioned to ma'am also, but I asked him about it, so he did not mention anything to me, so that's why I haven't. The last intake was, sir, on the 22nd of May. He went home, he drank for this. Yes. So he was admitted on 17th, 16th for alcohol intake tha. Continuous since March. Not according to the patient, but according to the wife. This was continuous. Yes. 23rd. Family history: second in order out of 4 siblings, of a non-consanguineous marriage. He lives in a joint family with his parents, wife, and a 6-year-old son. With history of hypertension in father, history of episodic alcohol use in father, history of chronic alcohol intake in first degree paternal cousin, and the patient has a cordial relationship with his family members. He was birth history, a full term normal vaginal hospital birth. Birth weight was about 3 kgs. The child cried immediately after birth. No history of fever, cyanosis, prolonged jaundice, breath holding spells, abnormal body movements, or admission to NICU. The mother is a little ambiguous about the immunization history because thoda recall bias hai. The patient was born in Haridwar. There are no history suggestive of any hyperactivity, inattention, repeatedly bullying other children, stealing, lying, setting things on fire, bedwetting, stuttering. And home atmosphere, there is no history of any broken home, desertion by parents, step-parent, adopted sibling. He started schooling from the age of 4 and he passed in 9th standard with first division, failed in 10th standard and did not pursue his studies there. So pre-morbid personality, I could not get any specific points as such. The only thing that I could get was his wife reported that he would indulge a lot in watching Crime Patrol, and apart from that, the mother has yes. Then general physical examination, icterus is present, and on abdominal examination, liver palpable up to 1 finger breadth below the cortical margin. Sorry, I missed. On MSc, he's a thin-built male. He entered the room with a bilateral wide-arm swing gait, unaided, accompanied by wife, sat on the chair provided and greeted the examiner. Wearing a white t-shirt and pajama, looked as per stated age, maintaining adequate grooming and hygiene. He appeared to be in touch with his surroundings, initiated and maintained eye contact. With a cooperative attitude, rapport was established. Speech was normal in tone, volume, intensity. It was clear, coherent, comprehensive, goal-directed with a normal reaction time. The attention was arousable, checked by tap test. It was sustained, which was checked by serial subtraction of 100 minus 7 up to 5 places. This is, sir, I will just get to. This is the MSc that I have done. And I will tell about the previous verbatim. I will tell about that before I come to thought. The previous verbatim that I got from this is the current MSc that I did. Then his memory, immediate, recent, remote were intact. He could. This was assessed by. He could tell his wedding date. He could tell what he had yesterday for dinner, and he could tell the 5 words that I gave him for his immediate memory recall. Then abstract ability was intact. Intelligent में comprehension, general information, vocabulary, calculation was intact. Mood, he said, sahi hai. Affect, the quality was euthymic. It was full range, reactive, not communicable, and was appropriate. Now I'll be telling the previous MSc a little bit about it. The previous, the second day. I will be telling about the thought content of that day. Then I will be coming to the thought content of the MSc that I took yesterday. Now, क्या आपको ऐसा लगता है कि बिन बताए आपकी मन की बात कोई जान लेता है? The answer was हाँ. क्या ऐसा होता है कि आपको ऐसी चीज दिखाई देती है जो दूसरे नहीं देख सकते हैं? हाँ, एक कीड़ा है, स्लेटी रंग का कॉकरोच जैसा दिखता है, जो पहले तो उन्होंने मुझे दिखाया और पहले धमकाया भी कि मेरे अंदर डाल देंगे, फिर मेरे अंदर उसको डाल भी दिया. आपको कैसे पता कि वह आपके अंदर है? मैंने देखा है एक लाइन जैसी देखी है मैंने अपनी टमी में बनते हुए, मेरे पेट में वो घूम रहा है अंदर से और मेरा खून भी चूस रहा है. आपको कैसे पता कि वो आपका खून चूसता है? मुझे कानों में चूसने की और अपने अंगों को खाने की आवाज भी आती है. इस कीड़े से वो मेरे पे नजर भी रखते हैं. Then the question was asked कि कैसे नजर रखते हैं? मैं जो भी सोचता हूँ कि जैसे मुझे आज ये पहनना है, वो तक उन्हें पता चल जाता है और फिर कानों में आवाज आती है कि अच्छा आज तू काले रंग की शर्ट पहनेगा. यहाँ तक कि जब मुझे यहाँ लाया जा रहा था तब भी मुझे वह कीड़ा महसूस हो रहा था जो मुझे अंदर से खा रहा था और मुझे वो यही बोल रहे थे कि भगौड़े तू भाग रहा है, किससे भागेगा, कब तक भागेगा. Yes, I did. So the MSc that I did yesterday, currently the patient is not reporting of any such complaints. क्या आप साफ साफ सोच पाते हैं या आपके सोच विचार में किसी तरह की रुकावट आती है? नहीं। क्या आपको लगता है कि जबरदस्ती आपके मन में विचार डाले जा रहे हैं? नहीं। क्या यह विचार ऐसा ऐसा तो नहीं कि यह विचार आपके नहीं है? नहीं, मेरे मन में मेरी ही बातें हैं, मेरे ही विचार हैं। क्या दूसरे लोग भी आपके मन के विचार को सुन पाते हैं? पहले ऐसा होता था, अब तो ऐसा नहीं लगता। कभी ऐसा लगता है कि जो आप सोचते हैं वही विचार आवाज के रूप में दोहराया भी जाता है? नहीं। क्या बिना बताए आपके मन की बात दूसरे लोग जान लेते हैं? अभी जब से मैं यहाँ आया हूँ अस्पताल में, तब से ऐसा नहीं हो रहा है। आपकी then again I asked about the visual hallucination. आपको अब तो नहीं दिखाई दे रहा है वो कीड़ा, या अब तो नहीं महसूस हो रहा है जो आप पहले जिसके बारे में बता रहे थे? अब नहीं दिखता है। और पहले जब से मैं इस अस्पताल में आया हूँ तब से मुझे वो कीड़ा नहीं दिख रहा है। मन में दिखता है कि साफ साफ ही सेड कि साफ साफ पहले दिखता था, अब नहीं दिखता है। देन आई आस्क्ड हिम, क्या उस समय आप थोड़ी नींद में थे? ही सेड हाँ, जिस एक बार मुझे वो कीड़ा चलते हुए लाइन जैसी दिखी हुई थी मेरे पेट में, तब मेरी मम्मी मुझे सुलाने की कोशिश कर रही थी। और तब हो सकता है कि शायद मैं नींद में था, मैंने मम्मी को दिखाया भी था, लेकिन उन्हें तो ऐसा कुछ नहीं दिखा था। क्या ऐसा लगता है कि यह मन का वहम हो सकता है? ही सेड हो सकता है, क्योंकि जब से मैं आया हूँ तब से तो मुझे ऐसा कुछ महसूस नहीं हो रहा है। लेकिन अगर सच बताऊं तो अगर ये तब तक मैं इसके बारे में पक्का नहीं कह सकता हूँ जब तक मैं वापस जाके इस चीज के बारे में नहीं सोचूंगा। देन आई आस्क्ड हिम, क्या ऐसा लगता है कि आपको जानबूझकर नुकसान पहुंचाने की लोग कोशिश कर रहे हैं? ही रिप्लाइड, हाँ जलते हैं मेरे परिवार से, क्योंकि हम सब रिच हैं बाकियों से हमारे मोहल्ले में। देन आई आस्क्ड हिम, ये आपको कैसे पता? तो वो तो माहौल ही ऐसा है, वहाँ पे सब हमसे गरीब है, हमारी आमदनी सबसे ज्यादा है, इसलिए ऐसा होता है। तो currently sir he is not reporting based on the previous MSc. The content of his thought included delusion of persecution, religious preoccupation, and delusional parasitosis. With sensory, with perception, visual, auditory, and tactile hallucination. PSC से देखिए सर, वो थोड़ा अजीब से होगा इसमें, because I thought that whether I should still ask them the same questions or now that it's already. So we don't mention कि आपने पहले ऐसे बोला. Yes. Religious. बस. Sir, possession, no formal thought disorder, stream, normal, circumstantiality was present, and possession, sir, initially his first line symptoms were present, thought, broadcast. Self, अभी तो self है. Yes. पहले था sir. Four days back. हाँ sir. Visual, auditory, and tactile. ठीक है sir. His judgment initially, the personal was impaired, and presently it's intact, and then insight has improved from grade 2 to grade 3. The TF. Patient, a 31-year-old Hindu male, second in order out of 4 siblings, studied till class 9, working as a stenographer, married for 7 years, father to a 6-year-old son, belonging to middle-class socio-economic status, living in a joint family in Haridwar, with history of previous admissions for complaints of jaundice in 2021 and 22, as well as renal calculi in 2022. Although the renal calculi is not, the ultrasound that we have done in the hospital, usme nahi hai renal calculi. They are same from previous reports. With history of episodic alcohol use in father and chronic alcohol intake in first degree paternal cousin, brother, presented to the emergency on the 23rd of May in a delirious state with complaints of alcohol intake for 12 years. Last intake being on the 22nd of May, average intake of about 1500 ml of Indian-made foreign liquor. Suspiciousness, restlessness, decreased sleep with auditory and visual hallucinations for the past 5 days. On MSc, thought retrospectively, we find delusion of persecution, religious preoccupation, and delusional parasitosis. Presently, the judgment is intact and insight is of grade 3. On the day of admission, his ammonia was increased to 58. His total leukocyte count was decreased, and ultrasound was then done, which showed mild hepatosplenomegaly with grade 1 fatty liver. Based on the following complaints, he is kept on a diagnosis of mental and behavioral disorder due to use of alcohol dependence syndrome, psychotic disorder, schizophrenia-like, with the second differential of psychosis NOS with alcohol dependence syndrome, and a third differential of schizophrenia with alcohol dependence syndrome. So that was my confusion as well, because the family members presented to the emergency with these complaints. So, and the HOPI that I have written, that is based on the account of the patient. So, and the relative both. So, both before HOPI and in the diagnostic committee. point of time पे तो कोई explanation था नहीं. Previously he said when they were admitted तब वो उस चीज को सर हो गए कम से कम like almost a year or something has gone by when he helped those people out in the hospital. 1.5 months is the amount that he would give. पहले भी देते ही थे but 1.5-2 months से सर वो amount बहुत ज्यादा बढ़ गया था. उसके साथ सर उसका ये because probably what he is thinking that if he does not abide by what these people tell him, so that insect will still मतलब he will eat him on the inside. So one more thing, the patient, when he was last interviewed, we clarified all of this that the bug is not inside of him and he cannot hear those people again. But he said that जो वो पहले damage कर चुके हैं, वो तो है अभी. So that said, we are not going to consider the possibility of psychosis in this, and not just we can explain his symptoms getting better because he's abstinent from the substance and there is improvement in his complaints. But sorry, sir. The line that you saw. Clear consciousness. I've mentioned this so that he wrote it down and those people got to know. Yes. I'm keeping a second. I've kept a second differential of psychosis NOS because of NOS and schizophrenia. Third, so schizophrenia. So because the conviction with which he said that जो damage उन्होंने कर दिया है वो तो हो ही रखा है तो ma'am further asked that if we get a CT scan or something done so do you think that will show inside so he said हाँ वो तो damage तो हो ही चुका है तो वो तो दिखेगा ही तो sir what is this supposed to and also that how that buck is a transducer So sir, he said that even if you get a CT scan or ultrasound done, that's still going to show the damage that it has done to my internal organs, that bug. And वो तो अभी शायद नहीं होगा वो कीड़ा अंदर, लेकिन जो पहले उन्होंने डाल दिया था उसकी वजह से जो हार्म है वो तो होगा ही होगा. Yes. Yes. Ask the same question. जब से छोड़ा है, जब से पहली बार लोकल हॉस्पिटल में एडमिट कराया था, वहां से जब वो डिस्चार्ज के लिए आ गए थे, तब से 16-17 मई से, उस टाइम से बोल.
मतलब इतने लंबे टाइम नहीं रहते हैं, लाइक दूर डिफरेंट का फर्क मदद कर रहे हैं और फर्क उसका कोई ना कोई बहुत ज्यादा टाइम के लिए दूर डिफरेंट रहेगा तो क्या हो, एल्कोहल बंद हो जाएगा या और भी कुछ आ जाएगा, ये नोट जो है वो भी आउट है. क्या नाम है आपका? क्या करते हैं? कौन है कंपनी? आपका नाम है? सारी कंपनी आपकी क्या हो? क्या पता चला क्या है पेट में तो ना तो ज्यादा पेट चल रहा तो ये 15-20 दिन में आप काम वाम कर लेते अभी है क्या चल रहा है कैसे क्या कहाँ से है खाने पीने वाले कैसे है थोड़ा कैसे कैसे चलो यूपी प्रॉब्लम कुछ और भी था आप बता रहे थे कल परसों को कि कुछ दोस्तों का दिया कुछ हमसे यार दोस्तों को कुछ प्रॉब्लम हो गया आपने दोस्तों को बताया कि आपका दोस्तों को किसी के साथ प्रॉब्लम हुई आपकी कोई नॉलेज नहीं है तो ऐसे माने मॉल के लिए मैं सिस्टम में ऐसा कोई दादा भी तक तो नहीं कर रहा यहाँ कैसे है तो ये ड्रिंक कब से कर आपने बताया था कुछ कोई जानवर या फिर खा रहा था किसी को वो क्या था कोई बात नहीं, जो आप क्या खाया किसने क्या खाया जानवर ने खाया या लोगों ने खाया हाँ किसको खाया ठीक ठीक हाँ इंसान ने किया के बाद खाना भी खाना जानवर ने लेडीज को अपना टारगेट बनाया क्या करना ये एक ही बार हुआ बार बार हुआ बार बार सुना है बार बार देखने की आवाज है आपने देखा है या सुन लिया बोलने आपने सुना है तो आपको क्या एक सवाल आवाज तो आपने समझ गया आवाज आपने क्या देखा आपने बाहर जाके देखा कैसे देखा हम जाके आपको डर नहीं लगा बताइए कि क्या अजीब चीज है ये टाइम कौन सा टाइम था 9 और अच्छा 12 बजे रात को 4-5 बजे निकल रहा है अच्छा 12 से 4 निकल रहा है 7 आगे ये तो की बात है कौन सी की बात बोल रहे हैं यहाँ पर ना सारे बात ठीक करेगा तो आपको लोग बताएंगे कॉन्फिडेंस लेवल क्या हाल है कॉन्फिडेंस कितना होना चाहिए कितना ज्यादा आपको लेवल क्या हाल है बताइए